Hi everyone, Dr. Steph here, back with a short video talking about one of the 15 different common causes that we find in our practice clinically for causing type 2 diabetes, and in some cases contributing factors to type 1 diabetes. So if you're interested in looking at how you can reverse your diabetes, you have to understand that it may not just be a simple fact of you're eating too much sugar. By the time you've had diabetes for some time, there may be any one of these or multiple of these other issues going on under the hood that are actually driving the disease process. And so they need to be looked at, you need to be tested thoroughly in order to determine which one of these factors is key for you so that you can successfully reverse your diabetes. This is why we get such great results in our office. So one of the things I'm going to talk about today is infections. And there are obvious infections, like if you have a cold or flu, you know you have an infection, or if you stub your toe and your toenail got a little infected, or you have an abscess somewhere, or if you have a root canal that's gotten infected, or maybe a tooth abscess. These are all things that can happen to anybody that can actually cause sugars to go high. And one of the reasons why is because it causes your immune cells to ramp up and try to kill and defend and clean up and destroy the enemy, and that is basically inflammation. To counter inflammation, your body may start to secrete cortisol in high amounts. Cortisol is a hormone that is made by your adrenal glands. It runs your sleep-wake circadian rhythm cycle. It counters melatonin. But one of the things cortisol is in the body is also your own anti-inflammatory. If you've ever heard of prednisone or cortisone, those are exogenous or external forms of anti-inflammatories. Cortisol is your own body-made anti-inflammatory. So if you have an infection causing inflammation, that can cause cortisol to be hypersecreted, which can cause your sugars to be high. And because this is an immune reaction to try to kill an infection, the sugars can be high for quite some time, irregardless of what you are eating. Many of you have actually taken a steroid, a corticosteroid, prednisone pill, or had a cortisone shot in a joint, and you saw your sugars go up, and man, they can stay up for months, irregardless of what you're doing, because it's a steroid hormone that is now in the system. Where things can get a little more complicated and a little harder and not as obvious is if you have some type of chronic underlying infection that you are not aware of, whether it's a virus that is kind of propagating under the hood, like Epstein-Barr virus, cytomegalovirus. These are very common. Maybe you have undiagnosed Lyme disease or some type of co-infection or other type of bacterial issue. So you've got some kind of like symptoms. Maybe your energy's low and you're sort of lethargic and you're tired, but you're thinking it's all related to the diabetes. Those can be factors. You can have other gut type parasites that you may be not aware of. You'd be surprised at what people are walking around with as far as parasite infections. So roundworm, threadworm, hookworm, pinworm, candida yeast or fungus overgrowths, not just in the gut but anywhere in the body, can be a contributing factor. And it could be balances of these bacteria. It could be high yeast and high bad bacteria in the system compared to the good bacteria. So it could be an absolute chronic infection or simply an overgrowth that is driving your immune system to ramp up to try to defend you and kill you, to kill your infection. And that's causing cortisol to go high, which then can cause sugars to go high as a counter response to that. And so unfortunately these things, if you're constantly chronically dealing with them, can be a very serious contributing factor to diabetes. That's just one of the ways that infections can affect your sugars. There's also more, but I just want you guys to get an appreciation for the fact that your diabetes may not just be caused because you're eating jelly beans and too much sugar. You need to be looked at and worked up to see, do you have underlying infections or overgrowths that could be driving your diabetes as well? Because if that's the case, then if you want to reverse your diabetes, you've got to address potentially these underlying infections. I hope that was helpful. That was just one of the 15 very common things that we find contributing to type 2 and type 1 diabetes. And so look out for future videos where we talk about some of the other 15 causes.